Now, in the United States, hospitals and healthcare workers in several states are dealing with the surge in coronavirus cases as the nation struggles to control the pandemic. The state of Texas has now joined New York, Florida and California by recording more than 400,000 cases. And our correspondent Larry Madowa has been inside a coronavirus unit in the city of Houston, where doctors say they are adopting a new approach to treating patients.
Please, come in. Welcome to the COVID unit.
Dr. Joseph Varone is chief of critical care here. Most of the hospital has been taken over by coronavirus patients. This old ward was converted into a COVID-only ICU, but within a week, they ran out of space and expanded. They now have 3 COVID units. UMMC is a small community hospital. 80% of the patients they see don't even have health insurance. And the doctors say it's all about timing. If they came any later, many of them would not make it. Dr. Varone is conducting a procedure called a tracheostomy. They're boring a hole in this man's neck to insert a tube into his windpipe to save his vocal cords. He's been here for 2 weeks, and if they don't do this, he may never speak again, even if he recovers.
I've never seen an illness that is so tricky. Every day I get surprised with corona. Every day there is a new thing, something new comes out.
The days are long and lonely for the patients here, with no family or visits allowed. The patients can only identify who's attending to them by the pictures hanging on their necks.
We're going to go and see Christina.
This is one of your nurses?
This is one of my nurses.
Nurse Christina Mathers was at work here when she too tested positive for COVID-19.
This is my other family. So to not be out there with my family is weird. To be on this side, it's like I'm still asking them what I can do.
He's saturating 88% when I walked in.
Dr. Varone and the team here try to avoid the use of ventilators. Instead, they use an experimental treatment, combining commonly used drugs in a unique cocktail to combat the inflammatory damage caused by the virus.
We have found from the New York experience, from the Spain experience, the Italy experience, that when you put a tube in somebody's throat, the chances of them leaving the hospital are less than 20%. The chance of my patients leaving the hospital are 95%.
The youngest patient is just 18. The oldest is in her 80s.
His lungs look amazing. Amazing. This is a guy that was not supposed to be around.
Nearly 60% of the patients at the hospital are Latino, and the impact on Hispanics across Texas is even greater. Efrain Guevara, a professional chauffeur, is almost heading home, but he does not plan to return to work anytime soon. He tells me coronavirus is real, and people who don't take care of themselves will die. The medical team describes this as a good week. Patients are improving here, but more than 1,000 people die of coronavirus every day in the US, and cases are rising in at least 30 states. Larry Madowa, BBC News, Houston.